Good evening, all the viewers who are watching live, and welcome to the 49 CME. And it's not my part, so we have wasted 1 minute, um, and we do not like to waste any more time. And we have upcoming 2 billion topics. So, without wasting any more time, let's just jump onto the CME. And one more thing before saying it, due to some issues with some misunderstanding and miscommunication between the IT team, we were unable to provide you with this registration link, and we beg pardon to you all guys. So with this, let's just start today's 49 CME.
Good evening, sir. Good evening, all our respected viewers across the globe. Good evening, sir.
Good evening.
Good evening, Kalyani, sir.
Good evening. Good evening to all of you.
Starting from number one, we had. Ne- ne- Thank you, sir. And now we are nearing to half century of CMEs. Today is 49 CME. And to inaugurate tonight's CME, we like to welcome our inaugurator tonight, Dr. Mrs. Bisolin Dhar. She is from Meghalaya, and I'll request our backstage editor to bring on screen Dr. Bisolin Dhar. She is our fourth batch BHMS
Hello.
from National
Hello,
Club
everyone.
Homeopathy, as well as she
Hello.
has been the medical officer and now the
Hello, sir.
register of
Good evening, sir.
homeopathy in
Good evening. Good evening.
Meghalaya.
Good evening, Kalyani, sir. Good evening, Viduda. And I'm sorry to tell you that the network is not so good over here. The voice that I can hear from you, it's breaking. I don't know whether it's clear or not. I hope I'm audible to you all. Hello. Am I audible?
Yes, ma'am, you're audible. Yes, ma'am, you're audible.
Hello. Hello. Am I audible? Hello. Hello.
Yes, ma'am, you're audible. Yes, ma'am, you're audible. Yes, ma'am, you're
I
audible.
cannot hear anything.
Yes,
Can you
ma'am,
hear
you're
me?
audible. Yes, ma'am. Yes,
Okay.
ma'am.
So,
Yes, ma'am.
okay. Okay. Okay, once again, good evening, Kalyani sir. Good evening, Biduda. And good evening to all who are joining this 49th CME program. It is indeed a great joy to see that the CME program online has reached the 49th. As Biduda said, it's going to be half a century. So I really appreciate the person or group of persons who brought forward this type of program because it's really a good thing for all of us NIH alumnus from all over India to have this kind of program. When I talked to my junior Sarah Karmauplang, I told her that we need CME. Then she said, "What CME? What we have in our NIH CME program is more than enough." And she's quite right. This is a very, very excellent program that we have from time to time. And we could see that excellent topic has come out. And even today we have topic on journey of infertility with homeopathy and homeopathy in divine motherhood. This is also very good topics that will be taken up by speakers. And I am so happy to inaugurate this CME. And I welcome our eminent moderator and speaker, Dr. Ompriya Mishra, and also Dr. Subhamoy Sarkar. So thank you so much, and I give the time over to Dr. Ompriya Mishra, to be followed by Dr. Subhamoy Sarkar. Thank you.
Thank you, Dr. Bisolin. I hope you can recall me, because I am recalling you in when I entered in my PG MD course in 2000. Sometime I saw you, most probably. So nice to see you again, and a very good evening to one and all present over here. Really, I am thankful to the whole CME coordinator group. Particularly, a special thanks and my regards goes to most respected Dr. Kalyani sir, who is taking this pen with his great pleasure, and every time he is giving his time and experience sharing to all with all of us. Along with that, I am also paying my regards to Dr. Bidyut Mukherjee, who is always there and always what to tell, always in a pushing mood to each and every one of us, that yes, this should continue. Sometimes we may get deviated because of this or that reason, unavoidable circumstances, but Vidyutda is always there for all of us. So thanks a lot to Bidyutda, and without thanking Orko, I cannot proceed further, because he is the main whole and soul person, rather the main keyboard of the whole program. So with a great thank to Orca, I am welcoming Dr. Subhamoy Sarkar, my dear student. He is found to be, because I found him to be very sincere throughout his BHMS career, and during internship he also has had his dissertation, his assignment actually, on this infertility, and with lots of effort and sincerity and honesty he saw all the cases, whatever we have during that 1 year period of time. And really, I am personally thankful to him that he gave so much effort along with me for handling all these infertility cases. So, without wasting much time, I am eagerly waiting to listen Subhamoy on his clinical experience on this infertility. So I am welcoming Subhamar. Please start your presentation.
Sir, you are.
Now I am audible.
Yes, sir. Yes, sir.
Okay, okay. Thank you, ma'am. Thank you very much. Uh, Good evening, all of you. My heartfelt gratitude to our President, NIH Alumni Association, Dr. Narayan Kalyani sir, our General Secretary, NIH Alumni Association, Dr. Bidyut Mukherjee sir. Sir actually was encouraging me for a long time to present my cases in CME. So finally today I'm here with my cases, and the joy of becoming a speaker in this enormous platform got double when I came to know that coincidentally that person who is my backbone, who is my mentor, who actually motivated me since my third BHMS till date, because of whom I got inquisitive in infertility cases. Today she is with us as a moderator come speaker, none other than Professor Dr. Ompriya Mishra ma'am. Pranam madam. And special thanks to all of our teachers of National Institute of Homoeopathy. Also thanks to Dr. Bisolin Dhar ma'am, State Nodal Officer, National AYUSH Mission. And last but not the least, Orko. He guided me a lot. So without wasting further more time, I'm just starting my topic, journey of infertility with homeopathy. So kindly switch over to my presentation or go. Okay. So my topic today is infertility. So I'm not going in detail about what infertility is and what are the types and all. I'm directly going to discuss the cases, especially. So first case of mine is secondary infertility treated successfully with homeopathic medicines within 4 months. So this case, 22 years old lady from Murshidabad, West Bengal. She actually contacted me through online, and I saw her over video consultation. So last year on 2021, she came on 5th of May, this month only. So secondary infertility was there for 1 year. They were trying for 1 year, but already married for 7 years. So 1 year before, that means 2020, she got spontaneous abortion at 15 days. At 15 days, spontaneously the product of conception got aborted, and after that, no baby was coming. So secondary infertility. And also she complained that irregular menstruation for 5 to 6 years, scanty menses, along with blackish color small clots was there. The cycle was yes, cycle is not there. Actually, cycle was 3 to 7 days, mostly get delayed, and dysmenorrhea during the first day of her menses. At that time, the last menstrual period was 14th of April 2021. Also, since her menarche, that means when the menstruation first started at the age of 12 years, since then she was suffering from leukorrhea. The leukorrhea was sticky sometimes, sometimes transparent in nature, and offensive, rotten smell, and throughout the month associated with weakness, fatigue, vertigo, nausea, anorexia, constipation, headache, left-sided, aching type, tingling type before and during menses. This is another complaint she told me. And in past history, I got chicken pox, measles, and her family members told me that she attempted suicidal attempt at the age of 10 years by taking some poison and hospitalized thereafter. This was one history I got. And urticaria was there, hypothyroidism. Earlier, she had hypothyroidism and snake bite 2 times. In family history, hypertension in 2 persons, diabetes in one, and asthma in 2 cases. In physical generalities, appetite was very much poor and cannot tolerate hunger. And if she cannot eat for a long time, then vertigo occurs. Thirst was 3 to 4 liter per day, and desire for fish, sour, 2 grade, double plus, and chili also double plus, raw onion, cold drinks, cold food, and water, but aversion to sweet. She doesn't like sweet anymore. Stool clear, and just after waking in the morning, the stool passes. Urine is clear, and frequent urination I got in her cases. And the sleep is adequate. Dreams, in dreams I got dreams of falling, dreams of flying, dreams of river, and dreams of snakes especially. She told that lots of dreams of snakes she used to see. In thermal reaction, patient is hot, and perspiration is profuse on whole body. Hair fall is there in the occipital region, backside. Catches cold very easily. The face is oily face, completely oily, and there are 4 number of warts present in her body. In the mental generalities, I got irritability, a bit of irritable at small things, and weeps whenever someone gives a consolation regarding actually she is not conceiving for long time. She got married for 7 years, still she didn't conceived, and there are lots of pressure from the family also that some in village area what we know actually happens that blames comes to the lady only. So these things actually going on. She was irritated and depressed also. Company desire, grief due to loss of the child, that spontaneous abortion took place, and suppressed anger, brooding over also there. She is straightforward and very much rigid in nature. Whatever she likes to do, she will do at any cost. She won't listen to anyone else. That once she is decided that yes, I will do this, she will do. And very much loquacious. Loquacious in the sense from one part to another, like this kind of talking, too much talking. Once she starts talking, she never stops, like that. Restlessness also, complete restlessness is there. So I prescribed Thuja occidentalis in 30 to 100 1 m, one dose each. At first I gave first day 30 morning empty stomach, next day 200 one dose empty stomach, and after that next day I gave 1 m, and Macphos 6x 5 tablets, 2 hourly SOS during menses, followed by the second best prescription. Why I prescribed Thuja? Because I'm just showing, going back to the slide. Uh, this is a case of infertility, and along with that, leukorrhea is there since menarche. We studied that whenever leukorrhea is present in any cases for long duration, in past history or present complaints, then we should think of Thuja or sepia. So in that case, I gave Thuja not only because of leukorrhea, but also there are craving for raw onion and stool. She used to pass early in the morning after waking. Frequent urination was present in that case. Dreams of falling is there, which is also a symptoms of Thuja. Oily face, words 4 in numbers. I marked all in yellow color for understanding. And rigidity, she is very much rigid. So psychotic dominant case, and that's why I first prescribed Thuja. So after, and also advised her for the folliculometry report, that whether the follicle size is good or not, whether rupturing at proper time or not, and also thyroid profile test, as she earlier had thyroid hypothyroidism, and husband semen analysis. So this is the folliculometry report at 13th day. 13th day, the follicular size is 15.5, and on day 14th, she didn't do the follicle test. On 15th, when she went to do the test, proper size we didn't get, and so I was confused whether that after attaining the maturity it ruptured or before that, so there was one confusion. When follow-up came on 6th of June 2021, she told that last menstrual period was 16th of May. It lasted for 4 days, and on 18th of June lasted for also 4 days, almost regular. No clots present this time, and that blackish color of the period also got decreased, and now it's mostly reddish. So after Thuja improved, and the amount of the menstrual flow, that was also significantly increased. Earlier 5 pads small size she used to use, but now 10 to 12 pads small size per day she uses. Dysmenorrhea starts only on the day and lasts for 1 day. Leukorrhea was also better for last 1.5 months after she took Thuja, and now not offensive also. So in this regard also improvement occurred. Fatigue, there is fatigue persisting. Constipation now better. Headache is there, left-sided headache compared to right, and discomfort feeling, aggravation during sleep and after bathing at noon, excessive heat and sun heat. So at that time also headache gets aggravated, and after massaging the headache ameliorates. Appetite also increased now. She used to see one peculiar dreams of sexual relation with unknown persons with her own wish. This is some peculiarity I got that she used to see earlier. She didn't mention that. And perspiration on face, palm, soles, chest is there. Hair fall in the frontal part of the head. Dyspnea sometimes, aggravation at night during sleep. Occasionally she used to have dyspnea. Patient is very much impatient. uh, Earlier also I told restless a bit, weak memory, and any congestive place like suppose if there is a gathering for much people, or if there is if she wears a tight clothing, that also gives her trouble. She cannot tolerate these things. But the twist in the story comes in the follow-up. When I asked her that you did thyroid profile also, you did folliculometry report also, but where is your husband's semen analysis report? She didn't bring. So without observing that whether that thing is okay or not, how can I treat? So I asked then, at first she told me lie that yes, my husband report is all fine. So I told them, okay, then send me the report. So after sometimes she is telling that, sir, now I cannot talk. I will call you just after 15 minutes. Okay. After 15 minutes, when she called back, she is telling that, sir, nobody knows this in my family. And I didn't also tell, because how can I tell? You assure me that you will also not tell to anyone else. I assured that it's our ethics that we should not disclose. Okay, I won't, but tell me what happened. So then she told me that we earlier also we went to two places in Baharampur, and there whenever we did the semen analysis, and doctor told that nothing can happen with your husband because sperm is completely nil. So after that we left doing that semen analysis report. Then I got angry and I told that if you don't treat your husband, then only by treating you, how could you think that the baby will come? So either tell your husband that he also take the treatment of homeopathy, otherwise I cannot treat you. So then the thing that she told me, it shocked me. She told that I am having a relation with my brother-in-law. So after listening that, I told, how come this idea came to your mind, and your husband is not opposing or anything, any problem? Then she told that no, for baby I can go at any extreme. I want baby at any cost, and so I have to do this. So I told that this decision is whose? This is my decision, and I only told and my husband that there is no other way and have to do. And the last baby, which was aborted at 15 days interval, that baby is also is not of her husband but of her brother-in-law. So after that, for last 1 year, 1.5 year, I could say that they are in relationship, and but still, when baby didn't come, so at last they came to me because in their family only the other brother-in-law, they are also suffering, and they contacted me through my junior from Meghalaya only. He suggested, and they got a baby, one baby girl also there after homeopathy treatment from me. So after listening that, they came to me. So this story actually doesn't make any sense to the modern allopathic systems, but for a homeopath, this is the eye opener of the case. And after listening this whole story, I searched in the Murphy repertory for proper rubric, and after that I came to know, conclusion that these are the three rubrics that will be helpful for this case. First of all, that is adulterous. This is adultery, nothing else. And other is objective, reasonable, moral feeling lacking. Why? See, adulterous means not loyal, not pure. Uh, Not loyal, not pure. One is not attached, believes, honest, committed, dedicated with one. Arko, am I audible na? Example, patient not believing in one doctor firmly, but trying, uh, patient not believing in one doctor firmly, but trying this and that due to lack of faith in treatment. Most of the time, it happens in our clinic also, in our day-to-day practice also, that patient is coming to us, and also she is going to another doctor or another allopathy or homeopathy doctor, whatever, that sir, I took that medicine also, and your medicine also. So this kind of thing, and on the basis of this theory only, a case of uterine fibroid, where three types of uterine fibroid was there, 6 numbers are there, and after 2.5 months of homeopathic medicine, that also got reduced to uh, one fibroid. So here patient is not loyal with the homeopathic physician and treatment, that is lack of loyalty, not pure. And suppose it is like, though husband is fulfilling all the needs, still she wants to enjoy with outsider man. This is just example, and this is a typical adultery. But if you see in another way, that if one female is not satisfied or not happy in relation with other husband, and so in relationship with another man, that is objective, definitely that is objectionable, but reasonable also, not justified morally, because she is not getting that satisfaction, and that's why she is turning towards another one. So though objectionable, still it's reasonable in this case also, that lady is not satisfied with her husband, and so she turned to that brother-in-law for that. And in Murphy repertory in page number 1506, if we see mind adulterous, we will get this medicine. In first grade, there are lots of medicine: lycopodium, platina, pulsatilla, staphysagra. These are first grade. In second grade, we are getting calcarea carb, medorinum, thuja, and in third grade, cantharis, carcinosin, causticum, fluoric acid, lachesis, natrum mure, phosphorus, veratrum, vipera. So lots of medicines in adulterous. In objectionable, in Murphy repertory, page number 1663, objective, reasonable. In that first grade medicine, second grade medicine, there is no first grade. That is calcarea carb, cali carb, and natrum mure is there. And in third grade, alumina, aurum, arsenic, belladonna, hyper, ignatia, lachesis, maxol, naxvom, platina, pulsatilla, like that. In Murphy repertory, page number 1660, moral feelings lacking. Here, first grade underlying medicines are lachesis and anacardium, and other medicines are hyoscyamus, stramonium, veratrum album, belladonna, like that, and second grade calibrum, other medicines are there. So now I have to just assemble all the three rubrics to know that which medicine is actually covering all the three rubrics. As I don't have any computer based repertory, this process was a bit hectic for me. So I first chose that adultery rubric, adulterous, because I thought that yes, this is the only rubric to be chosen first, and after adulterous, objective, reasonable, moral, feeling, want of, I got two remedies in common: lachesis and platina. So as we know, platina has very high sexual drive, so no one can satisfy her. So platina is adulterous. And in lachesis person desires amusement, playful and frivolous, not serious in relationship, so may want adultery as a amusement or play with other man. So like that way, I thought that, let's just compare all the medicines in adulterous. So how can we compare? If we add adulterous with change desire for, then two medicines are coming, medorinum and pulsatilla. Here medorinum and pulsatilla both are adulterous as the desire for change. But medorinum is ardent and adventurous, while pulsatilla is mild, frivolous, not serious in relationship, dishonest and cowardice. So in this way we can differentiate this medorinum and pulsatilla's adulterous nature. If we combine adulterous plus female sexual desire, violent, irresistible plus hypocrisy, then causticum and phosphorus coming. Causticum and phosphorus are adulterous due to violent, irresistible sexual desire with hypocrite nature. But phosphorus desires amusement, where causticum doesn't. Like that, adulterous plus amorous. Amorous. Hello, Orko, am I audible now? Bidyut sir, am I audible? Can anyone tell me, am I audible or not? Because some call came suddenly. Okay, I'm just continuing. Uh, okay, ma'am. Then adulterous plus dwells on sexual matters. Then one medicine is common, that is staphysagria. So staphysagria is having both adulterous and as well as sexual matters dwelling characteristics. Then ignatia. Ignatia is adulterous and also sentimental in young persons. Then adulterous plus female sexual desire suppressed, ailments from suppressed sexual desire, sabal cerulata. Adulterous plus sexual desire insatiable, rage in paroxysms, one medicine, that is cantharis. So, thank you, Dr. Prolay sir. If we go to Murphy repertory page number 548, dream section, then also we can see that lachesis is coming. Lachesis is in the first grade. Then if we go mind, in page number 548 Murphy repertory, then also if we see impatience rubric, there also lachesis is there, I think in the second grade. Then at last my second prescription was lachesis, 200, 1M and 10M potency, one dose. First day I gave 200, next day 1M and thereafter 10M. MacPhos 6X was as usual SOS, and then the second breast prescription. and I made this second prescription on 6th of June 2021, and pregnancy positive report came on 19th of September 2021. So in between that, I didn't give any medicine, and USG of the pregnancy profile was done on 24th of November 2021, and as per the USG EDD, it was 17th of May 2022. That means today is 22nd of May, so the date was just prior to that. After that, that photo was taken on 8th of April 2022. This is so this is the outcome of lachesis. So this is a lachesis baby. Date of birth was 21st of April 2022 at 10 o'clock at night. Weight was 2.2 kg. Caesarean section delivery was there. Caesarean was done because the breech presentation was done. Most probably, I saw the report. So this is in Murshidabad, that Reginagar nursing home. So at night, the patient called and telling me at 10:30 that sir, Lakshmi came in our house at Thursday because of you. So in this way, that after analyzing the case with different angle, finally I got succeeded, and then I realized that in homeopathy there is no shortcut. In every case, we have to take it as a new one. Otherwise, there is no option. So this is another secondary infertility case. Recently, I have posted this case in my social media. Within 1.5 months, this case responded to our homeopathic medicine. This is a case of 32 years female from New Delhi. The secondary infertility was there, and the patient came to me on 23rd of March 2022, this year only. So they are married for 5 years, but for 2 years they are having secondary infertility. 2 years before, one missed abortion took place at 9 weeks 4 days. So at the third month that got aborted, there was no cardiac sound at all, and at last D&C was done. And also the patient complained me that burning sensation in the vagina was there before menses. This thing she told me very giving intensification, and that time last menstrual period was 24th of February 2022. And that cycle, in this case, the I think it's not visible, right? I think so. Cycle was actually 2 to 4 days. I know that, and 26 days cycle, 2 to 4 days it used to last, and that regular, and needs 3 pads per day. That is XL size. We have to know that size of the pad also, because sometimes patient used to say that, sir, too many bleeding is happening, so I cannot assess that which kind of pad she is using. So this is, I think, one criteria to assess whether it's a really huge bleeding or not. So in past history, I got many things. Chicken pox is there, malaria is there, typhoid is there. Then she had anti-tubercular drugs, that is DOTS treatment, and the patient informed me that not only for 6 months, but some reason she had to take for 9 months DOTS treatment. Patient is having hypothyroidism, thyronorm MCG, 50 MCG is taking she, and also she had a history of allergic rhinitis, dust allergy, and along with that, patient had a history of left-sided hydrosalpinx, and a right tube, light fallopian tube, was faintly visualized. Then DNC and OCP she took for 4 months. So these are the past history that I could gather. And in family history, 4 persons are having hypertension and 6 persons are having diabetes mellitus. So this is the report of ultrasonography which was taken on 10th of June 2020 showing missed abortion. This was the HSG report on 2019, 2nd August, where it was mentioned that left-sided hydrosalpinx most probably and right-sided also faintly visualized. But on 21st of August 2021, when she again did the HSG, hysterosalpingography, so at that time it was normal. Folliculometry after ovulation induction. This was done in this year only on 1st of February 2022. At that time, the patient was having 14th day of LMP. At that time, left ovary was having dominant follicle, and the size of the dominant follicle was 28 by 28 by 26 mm. So already it matured, but still it didn't rupture. And the endometrial thickness was 12 mm. On the 2019, she did testosterone report also. I saw that testosterone was within normal limit. And then next, on 16th day of LMP, the left ovary was having dominant follicle with irregular wall, and there is showing minimal free fluid in the pelvis, suggestive of ovulation. But that dominant follicle was not completely ruptured. But again, the size of the dominant follicle got again increased, 32 by 24 by 22 mm. On 7th of February 2022, when again they did the follicular study, so at that time they found that cyst with septation, and that cyst was size 47 by 46 by 41 mm. Endometrial thickness is 13 mm only, and no fluid in the POD. So after having this, observing this report, it seems to me that it might be a case of LUF syndrome, that is luteinized unruptured follicle syndrome after ovulation induction. So in Global Journal of Health Sciences, in article effects of letrozole HMG and clomiphene HMG on incidence of luteinized unruptured follicle syndrome in infertile women undergoing induction ovulation and intrauterine insemination, a randomized trial was there, and in that study it was written that we illustrated that larger follicles of greater than equal to 22 mm diameter were associated with higher incidence of LUF syndrome. So whatever may be, but I think this is the defective folliculogenesis case. So then I took again the complete history, and in physical generalities I found that appetite is quite good but cannot tolerate hunger at all. Thirst is less, 1 liter per day, and desire for sweet extreme level, cold drinks extreme level, and also there is desire for salty things, but she has aversion to extra salt. She likes salty things, but not too much. She likes chicken, fish, raw onion, etc., and aversion to sour, intolerance to brinjal, and the stool 1 time per day, but not so clear. Urine is clear. Sleep is very much poor, disturbed sleep. Once sleep breaks, then again sleep doesn't come first. Then dreams of falling. Dreams of falling here is here also present. Dreams of snake. Thermal reaction, she couldn't specify me whether hot or chilly. I couldn't understand. Perspiration is moderate, and there red moles. That this is the red moles are suggestive of psychotic character. So after having all these things sweet desire, intensity of sweet is very much here. Then intensity of cold drinks desire is too much. So this combination of sweet and cold drinks, we can see in Silesia also, and I think also in tuberculinum also it's present. Then if we go back, then I can show you that patient is having hypothyroidism. So any hypo or hyper activity of the endocrine gland, then past history or family history of either allergic rhinitis or dust allergy, then missed abortion at the 3rd month, and also that means uh, that abortion took place at a very early stage, and the secondary infertility. So on those points, it's clearly a case of thyroidinum, and I prescribed the thyroidinum directly in 10 power. 2 doses I prescribed in 30 ml of aquadist and ODAC into 2 days, followed by folliculinum 30 from 7th to 17th day of the menses. As I could observe that there is something problem in the follicular study. So as an assistant of thyroidinum, I just prescribed this medicine, and the patient started this medicine from 25th of March this year, 2022. And I advised the patient for USG TVS of the lower abdomen, then follicular study from day 12 to day 17 till rupture, serum blood for thyroid profile, as the patient is already taking Thyronorm 50C. So I didn't disturb that, and I wanted to know that whether thyroid is in balance or not. And husband's semen analysis I gave. She did the report on 25th of March that thyroid profile is within normal limits, and then semen analysis was also done on 27th of March 2022 in from New Delhi only. That is also normal. Then USG of lower abdomen 29th of March 2022, that was also normal. So in that thing, nothing was abnormal. But folliculometry, that the thing that I wanted to do, because in February there was a problem. But she couldn't perform because she belongs to Islam community, and so Rosa already started. So patient told me that, sir, after April, on May month, I will surely do. But by the grace of God and homeopathy, that also not required. And on 11th of May 2022, within 1.5 months, the patient conceived, as her cycle is 26 days. So on 8th of May, actually, period should come, but period didn't came. So on 3rd day, she did that. And after that, I suggested to do beta HCG total. And on 19th of May, just 3 days before she did, and it was 27,809. So in this way, this case also got success. So today, these 2 cases only I could prepare. And thank you all for patiently listening to my uh, presentation. I think you liked it, and if any question is there, you can ask. Okay, hand over to Dr. Ompriya, Mr. Ma'am.
Thank you, Dr. Subhamoy, for presenting so nicely these 2 amazing cases. These are really, what to tell, the eye opener for all of us, that whatever may be the pathology, whatever may be the situation, whatever may be the condition, if we are taking the case sincerely, carefully, and making ourselves one with the female and her family, then definitely we can succeed. So in both the two cases, the first case that you told, that you consulted the Murphy repertory. Yes, the consultation that you did and the rubrics that you took, like this adulterous, this objective, reasonable, moral feeling lacking, all these rubrics that you take, that you explain very properly, very nicely, that what are the rubrics you take and the totality, on the totality basis, what are the medicine that come. Yes, the presentation is really, really, really one out of the level, I can tell. It's really fantastic, and the result is always a very encouraging, and what to tell, it requires a lots of praise and applause. Definitely you are going to get the blessings of the whole family. The difference that you gave in between this meadow and pulsatilla, causticum and phosphorus, and each and every step, that you gave your effort in each and every point to tackle the case that you used to do. I have seen you already. So the same thing that you are also continuing with a bit more sincerity, really feeling extremely proud by seeing all these things. And the second case, that with no time, that I can tell, only matter of 1.5 months. This is simply nothing. The patient took the medicine, and within no time, that where the condition was something like defective folliculogenesis, or what you told, that is this LVF syndrome, luteinized unruptured follicle syndrome. So again, I am telling what I used to tell in each and every class to all my students, that never get afraid by seeing the diagnosis, whatever may be the diagnosis. If you are having the case, if you are taking the case with proper sincerity and giving your best, then always be very sure that yes, we are going to succeed. Of course, failure is a part of each and everything, but 100% sincerity from our part will definitely give the proper and good answer in right time. So really, I am very happy with the presentation of Dr. Subhamoy. So extremely feeling good and congratulating him for presenting all these two cases. I hope if he could present more case, then the flow should continue. It should not stop. I know he has much more in his stock. Okay, someday or other, we will again request you to come to the platform, and we will listen to you again. So, as you know, that this infertility, this is nowadays is becoming so frequent and so common, that the number of lifestyle factors that now affect the fertility in women and also in men. Not that the only woman is affected, but the men is also affected. These include the nutrition, weight and exercise, physical and psychological stress, the environmental and occupational exposures, the substance abuse and drug abuse, and medications. So example, as you all can know and have a bit of this experience, if there is obesity, if In case of male, definitely there will be low sperm count and the sperm quality will be also reduced. And if the female will be obese, maximum chance that she is suffering from PCOS or hypothyroidism. And if there is underweight, then this is the conclusion that she is suffering from ovarian dysfunction and ultimately will result in infertility. So nowadays exercise we are not doing properly. Many a times, many people, that there is lack of time, there is a lack of environmental support, there is a lack of family support, that the male or female, they cannot have the time for exercise. The occupation is so that they don't get any time. So they simply don't have any exercise, or sometimes they are so much health conscious, so they are so much body conscious that they are doing extremes of exercise, leading to the physical stress. So in both the cases, we can find that we are getting the patients and we are finding that their sperm quality is automatically affected in case of female, and the ovulation is automatically affected in case of female, and the sperm quality is automatically affected in case of male. And nowadays also again the body making fashion, that some medications are required to make the body, to build the body, some androgens are required, so automatically that is also affecting the sperm formation. So in all these way, means if we are not leading a balanced proper life, then definitely infertility is going to happen. There is no question that we can prevent it. And what to tell, particularly in our environmental effect, the noise is there, and each and every point that we are taking, the food, the environment where we are working, and the family where we are living, the office where we are working, each and every place we can found different types of elements are present that affects the fertility factor. So pollution is affecting the gametogenesis of both the male and female. Different studies are there. Stress that alone can cause infertility, both in case of male and female. This is depression, this is anxiety. I can tell that one case share, that that case I got something around 2016 from Patna. So that case, when that was the actual, that was the first case most probably who boosted up my confidence that yes, we can achieve the so-called, what to tell, the so-called uh, means which is being unanswerable by the so-called conventional mode of treatment. We the homeopaths have the answer for it. I got the case. That case was bicornuate uterus with bilateral tubal blockage. So she had already one miscarriage at third month, and she came over here, and followed by that also she visited Vellore and more or less different parts of India, and doctor told that yes, you have both the tubes blocked and you have the bicornuate uterus, so there is no question of doing anything. So ultimately with all the what to tell, disheartenedness, with all the depression, with all the frustration, she came over here in NIH in one winter morning. So whenever I took the case, already the intern took the case. So whenever I just want to verify and re-verify the symptoms, whatever the questions I asked, I simply didn't get a single answer from the lady. The lady was just sitting silently with great depression, not even looking at me. Whatever the answer was given by the husband. So though the case was taken well, but this typical observation that I found along with her totality of symptoms that dislike to speak or be spoken to. Yes, we found that in our Matra Medica we have few medicines, natrum sulf, written in natrum sulf, and in bracket there is iodine and silicea. So the totality goes in favor of natrum sulf, and I prescribe natrum sulf, and that was followed by placebo for 2 months. And definitely, I have no shame now to express that I just gave the medicine and thinking that chalo bhai, let the patient move with the medicine, let the patient move with the medicine, and let us let me be free from this effort. That definitely what can I do in the both the complete tubal blockage and biconvert uterus. So ultimate thing that after giving natrum sulf and occasional doses I gave of thiophanate in the second prescription, and that was followed by I advise just on my inquisitiveness I advise to move for a HSG. Let us see what is happening in the HSG. What I found that the yes tube which was completely blocked, one tube was 100% open and another tube was more or less 75% open, only slight fembrile block was there. So that was the result within 6 months. And then followed by the continuation of the same medicine. And followed by that, after 3 months, the lady came with a pregnancy positive report. So this is actually the miracle of homeopathy. This is really the miraculous side that we, the homeopaths, we are showing to all the world. Yes, now the question will come that what will happen to the pregnancy? Sometime, because this time I am not going to share any case or presented in PPT, because my intention is that many times Dr. Bidyut Mukherjee requested me just to have a special seminar on all these things. So I hope that by next month or some other time I will have the presentation of all these cases. So today I am just sharing it. So that case continued throughout the pregnancy, the homeopathy treatment. Minor ailments, only the treatment was given. Sometimes knock, sometimes like this, knock 30 or something. Then the whole pregnancy was continued and she delivered a full-term baby boy. And followed by that, till now I have 2 to 3 cases. Yes, most probably 3 cases of this biconvert uterus, where definitely biconvert uterus is a congenital anomaly. I cannot tell that biconvulsion has cured because I don't have any report followed by the delivery. Followed by the delivery, no mother has reverted back to know that what will happen to the next pregnancy, and they never move for the next investigations. But yes, the answer is that this ends in a full term delivery, even in case of biconvulsion. And the tubal blockage that we are considering, if you are going to have a case of tubal blockage, means the patient definitely is being advised to move for IVF. Means without IVF, there is no answer. Yes, the answer is sometimes surgery. The conventional mode of treatment, they advise for surgery, and the answer of surgery or the result of surgery is always in a question mark. So many patients that I am getting from this infertility center near NIH, and they all are advised for this. Even they have gone through this process of IVF, process of what to tell, this ovulation induction process. All these are highly painful, highly expensive. Still then, having the baby is always a dream of each and every lady, that to be the mother, to be a mother. This is the highest pleasure that a lady could get. And to get this pleasure, what Subhamoy described in the first case. So that is the desire that the lady, even by sacrificing her loyalty, sacrificing her the social norms and everything, she was in relation because she want to have a baby. So with this pain and with this desire, each and every person come to us. But the thing that we should remember, that we should keep in our mind, that while treating the case of infertility, we should never forget about the accessory circumstance. We should never forget to take the case at the very fundamental level, at the very grassroots level. A proper case taking is highly, highly essential. And before each and every case, it requires minimum investment of time till the patient gains confidence on us. Until and unless patient gains confidence on us, until and unless patient share all the feelings, the desires, the aversions, the physical things, the sexual problems, until and unless patient disclose each and everything to us. Sorry, it's really a difficult job, a tough job for all of us. This could never be a mathematical procedure. Yes, क्या desire है? Desire for sweet, desire for aversion for salt. Okay, you are a hot patient, you are a chilly patient, you are irritable. Okay, let us prescribe this. No, this could never be the case with infertility. Because fertility is such a thing that it is just creating a new life. And whenever there is any imbalance, any disturbance in any point, that will cause infertility. Even everything is perfectly okay. I have few cases, everything is perfectly okay. Means the machine is telling that everything is perfectly okay. But what machine is not telling, that she is highly disturbed mentally. What machine is not telling, yes, just only last 2 to 3 months before I got one case, that she had the history of dog bite 4 times. So that machine is not telling. Machine is telling that yes, she had lot many. Her whole pelvis is full. That case I am telling that she had history of dog bite 4 times, along with lot many past history and lot many family history, and presently her full pelvis is having lot many pathologies. Ovary is disturbed, uterus is disturbed, tube is disturbed, her cycle is disturbed, everything. So that case, I prescribe lysine 1 ml, 3 doses I prescribed followed by placebo. And by the time her more or less, only last week she came with the USC report. I advised to repeat the USC because each and every case is a learning point for us. That really we have gone through the Mater Medica, whether it is really affecting. Let me see. Because until and unless I will be very sure. How can I teach my student? Because they all are watching towards us each and every day. So I advise to move for the USC and it is found that the pathology which is still there, but the size is very much increasingly, what to tell, encouragingly reduced. And the menstrual irregularity what she had, that is also reduced, and she had also dyspareunia. Yes, that is also reduced with this lysine. So which point we have to pick up? We have to decide that aphorism 153, the peculiar rare symptom, that uncommon symptom, we have to take notice of, and that could never be possible if you will be very hurry while dealing with the case. One another case that I would like to tell, that she was also married for 5 years. She also had the bilateral tubal blockage and increased prolactin level, highly increased. And the patient, when she came, she was from Baripur. So she is very lean and thin, very lean and thin. And her, you can imagine, her weight was only 35 kilo. So very lean and thin, complete irregularity of menstruation with excessive abnormal vaginal discharge. So here, nothing but the constitution, the very typical constitution that guided me for the prescription. Yes, I prescribed Sickle-Core. So Sickle-Core 200 followed by 1M, and within 6 months, both the bilateral tubal blockage, yes, that was there, but the answer is pregnancy positive. And she also delivered a full-term baby boy with normal vaginal delivery. That was just one day before this lockdown was there. So this is what my point of discussion over here, what I mean to focus over here is that we have to consider the accessory circumstances. It should be very meticulously taken care of. Yes, I was just going through some of the parts of infertility, and what I found very interesting, that in our environment, whatever the foods we are taking, even the water that we are drinking, if our plumbing system is too old, then that water may contain heavy metals, and that may affect the spermatogenesis, leading to infertility. If someone is having this tendency of, I had one case also again, that she had the tendency of, she used to have this painting and all these things, and tendency of putting the brush always in her mouth. So she had the infertility, along with she had also very severe gastric pain, and the cause of infertility was also the tubal blockage. The medicine, yes. This point didn't I get on the first visit. In the subsequent visit, when the patient came, I again inquired, and I found this particular part, that what is your hobby? That is not her occupation. She is a housewife. But what is your hobby? That my hobby is painting. And whenever, then she told, her partner actually told, that whenever she used to do painting, she used to just what to tell, put the brush on her tongue and then doing all these things. So putting constantly all these things. So plumbum met I prescribe, and that plumbum met completely cured the case, and the answer is positive. So all these things we have to taken care of. The occupational hazard nowadays that is occurring, particularly I am getting the couple from IT sector. What is the problem is there in the IT sector? That both the husband and wife, they are working, and both are having shifting duty. Husband is leaving in the morning, returning back in the evening 8 o'clock. By the time wife has started her work and she will be back next day morning. There is no time to meet. But ultimately they are coming to a doctor to have a baby. And also, definitely they don't know what they are expecting. Our advice is again, either you stay together or you move for the machinery, what to tell, machinery children production center. Because we don't have any answer for the couple who don't have any relation with among each other. But yes, this is the thing that is going on. I also have few couples where they are not at all eager to have, even they have time. They are busy with their phone, they are enjoying everything on the virtual mode, but they are not at all ready to have that is called as a physical labor for them. To have relation, they found it as a matter of physical labor. They want everything in a virtual mode. So we cannot help in that category of people also. They don't have any exercise, they don't have any positivity, they don't have anything to do, and everything they want on a virtual mode. But ultimately, when the time comes, 5 years, 6 years, 10 years just passed, and just after that they think, chalo, let us move to a doctor to have this infertility treatment. So that mistake I made while starting the treatment of these cases, this category of cases. Definitely, I thought that because couple are coming to us for infertility, they are supposed to have their relation, good relation. But one case of azoospermia, where that case improved with syphilinum. Syphilinum I gave, and after 3 months, I found that the sperm count come to 20 million. Then followed by the next 3 months, it comes to 40 million. Dr. Yeshidas sir was there, so he was highly encouraged to see the report and told that, ma'am, this is something really unbelievable, that a azoospermic case that improved so nicely. So it's really encouraging. You please publish it. But that is long before, something 10 to 12, 10 years before. So I was eagerly waiting. Yes, now the male has improved. The female is having no such problem. So other than the couple, I was also interestingly waiting for them, that when I'll get the good news. But again, months and months and months passed. 6 months passed, and what I found, that one day again I started taking the whole case and asking and interrogating the couple again. And what I found, that the couple, they are staying apart in each other's house. Lady is staying in her own house and the husband is staying in his own house. They didn't have any relation for last 1.5 years. And still then, they are coming to a doctor for infertility treatment, and I am giving the treatment. And the result is that the report is improved, but the answer is 0. So yes, these sorts of mistakes that make me again putting this question at the very first visit of infertility couple. And to my utter surprise, what I am finding, that frequently also I am getting the couple, they don't used to have any relation among them, but they are coming to a doctor for infertility. So this point also to be taken care of, and proper advice also should be given, that when to have the relation, how to have the relation. So many times whenever we advise, that also increase stress on the couple, that yes, this is the particular time they should be in relationship, otherwise there will be a miss. So that increased stress also will affect that fertility factor. So accordingly, we have to advise the couple properly. And yes, nowadays noise pollution is there. So what the noise pollution is also causing, that whenever the sound becomes more than 55 decibel. And there is one study that I found today, that one study was conducted in South Korea on 2,06,492 men, which was published in the International Journal of Environmental Pollution, which is telling that yes, if the noise level of more than 55 decibels will be for 4 years, especially at night, then that will be associated with the increased fertility problem. So these are the lot many things that is affecting our fertility. And those persons who are working as cook in different restaurants, in five-star hotels and all these things, working in some company in some hot chamber. So in those cases also, we have to advise accordingly to change the occupation. So all these things. So my main motto of what I want to tell today is that infertility, we have not, if not all, 99% chance that if we can move properly, if we can have the proper treatment by taking the case very thoroughly, considering the past history, family history, personal history, sexual history, and the past treatment history also. The way Dr. Subhamoy showed the case, two cases, very nicely, very meticulously he took, then definitely we can have a big answer to the infertility problem. We can be the leading source for all those couple who are suffering from infertility, and we can have a big hope for the infertile couple. And through homeopathy, yes, we all are getting the blessings. So with this, I am concluding today, and I am again thanking Dr. Subhamoy for his nice presentation, and bless him always, and will pray to God that you should succeed in each and every case like this. So I am concluding here. Thank you all. I am requesting now our today's inaugurator sir, inaugurator madam, Dr. Bisolin, she is here. Dr. Kalyani sir. Yes, Dr. Bidyut. Yes, my part is concluded. Hello. Hello, am I audible? Okay. So net issues is there. But whether my voice is audible? Okay. Okay, thank you. So yes, one thing. If net issues is there, so let me ask one. Yeah.
Ompriya, I think I am in a meeting, in a party. I will request Pralay to take up the hosting with Kalyani sir. Over to you, Pralay. Kalyani sir,
Yes, sir.
it's
No
presentation
problem.
now by Ompriya ma'am and Subhamoy. Over to you, Pralay.
Thank you so much. I'm very honored to be here today in this platform once again. At the outset, I would like to thank Dr. Bisolin Dhar, Dr. Ompriya Mishra, Dr. Subhamoy Sarkar, and of course our President Dr. Kalyani sir and Dr. Mukherjee. It was a wonderful evening today, and to listen from our very dear student Dr. Subhamoy, and we have seen him in our institute too. He is very particular, is very serious about his job, and he keeps on updating us in the Facebook profile, and from there we understand that he is doing well with his clinic, especially in terms of infertility. And today's discussion regarding the infertility presented by Dr. Shubhamoy, that has in fact showcased us, has shown us the path, particularly to the new generation, that once you become serious about your duty, once you be very honest about your profession, you can succeed it. It's not, the prescription was not on the basis that simply by taking a totality of symptom, understanding the generalities and the complaint, the medicine was prescribed, is absolutely not that. To analyze the symptom and to understand the exact symptom on which the medicine to be prescribed, that was the lead of a successful story of his clinic. I believe that Dr. Shubhamoy will come up with many new cases. And of course, we have listened to Dr. Ompriya Mishra. What we do in our hospital in National Institute of Homoeopathy, infertility case means Dr. Ompriya Mishra. We do not treat. But what we treat is the maximum of the cases in different OPDs, that is PCOS cases, polycystic ovarian syndrome cases, that is not been screened as like that of the infertility cases. But as we all know that once we are treating a PCOS case, we are basically preventing infertility. We are preventing the complication of PCOS in terms of infertility. That experience we do have. And Dr. Mishra been very right person, and she is doing well in our institution. And we have many success stories with Dr. Ompriya Mishra, and I believe that Dr. Sarkar will go ahead with his clinic and infertility, and Dr. Ompriya Mishra will always guide the students as well as to us. And we will not, I will not talk about the PCOS today, uh, but it was a wonderful evening today. I would like to listen from Dr. Kalyani sir. He has a vast experience. Now it is 9:30. We can go ahead for another 15 minutes by talk of Dr. Kalyani sir. Kalyani sir, will you add something into it, sir, today?
Let me try. Thank you, Pralay. Thank you, Bidyut. Special thanks to our inaugurator today, Bisolin Dhar, for coming with us and nicely inaugurating the program. At the same time, definitely she is encouraging all other alumni who are working in distance far away from National Institute of Homeopathy campus. Many thanks to Subhamoy Sarkar for giving brilliant presentation. And from all of us, it is our earnest request you go on preparing your cases come to us, present that to encourage all of us. Many thanks for working on a special subject. And for Ompriya Mishra, what should I say? One thing I cannot but to tell you everybody, and I request all of you to follow her instruction, her habit, that whenever any case come to her regarding within his domain, gynecological cases, he instantly asks for investigations. And if patient refuse to investigate by spending money or from the hospital free of cost, madam usually do not entertain that much, because it is a strict instruction that unless bring me reports, how can I understand the case is improving or case is stable or case is deteriorating? This is clinical part. But the basic part for which I request to all of you to follow her instruction. If you want to improve homeopathy, we are bound to present before the modern or traditional system of medicine that we are able to cure by the certifications of oncologist, biochemist, then gynecologist. They should certify our recovery on reports. So please follow her instructions strictly, that whenever get interesting or less interesting or casual cases, always try to ask the patient, to some extent forcefully, bring the report first. Let me know, let me be confirmed what disease you are suffering from. Then only we will be able to understand the uncommon symptoms. Now, I am definitely blessing to Almighty for your development, Ompriya ma'am and all other speakers. He has rightly pointed out that more will be modernized, more will be away from the nature, more will suffer from infertility. Like the days more you are advancing, since our beginning in medical science, by these 40-45 years, what we are finding, the number of infertility cases are increasing. There are various factors. First factor is we are gradually becoming away from the nature, and fertility, libido, hormonal functions are absolutely dependent on nature's biolimbic system, neurohormonal system, and then somatological system. So if you want normal fertility to the patients and all of your other family members, ask them to be as much as possible with the nature, not away from the nature, through diets, through habitats, to desires. The peculiar thing what we are finding during our student lives and early teenage lives, I have also seen to the student that young boys and girls are very fond of affections, not for financial causes, not for brilliancy, but for likings only. Like one girl likes one boy, boy likes one girl. But now it is what I am finding. This choice has completely gone away from love or affection. It has become more dependent on financial source, his capacity, his status, etc., etc., other than this natural phenomenon that is love and affection. Infertility, the basic point is there. If we are away from the love affection from our partners, we are bound to suffer from infertility, either today or tomorrow. So please be careful and ask the patient accordingly. Infertility is such a case. The problem lies there. It's not a national problem, it's an international problem. Gradually, our family becoming little families. It is called as Shuki Choto Purivar, Shuki Purivar, means small family, happy family. But the experience says, more you become a small family, more you become unhappy by your wife or husband, by your children. The children, only one children is becoming self-centered. He have not learned to share with others. His foodings, pain, entertainment, pleasures, he is alone. So anyway, I am not advising to have multiple children, but what I am advising that you should keep it in mind that Choto Purivar does not mean only 3. If you are having only one child, guide him by which he have many friends, big circles, gradually goes to the nature, to the society, and mix with all others. Let the boy or the girl feel that I am not alone. We are many by your friends, families, and relatives. That is one factor for the psychological problems. Let me tell you my first experience. There is one surprise. It is simply an incident, and maybe this was an encouragement by the Almighty. At that time, I was a student of Calcutta Homoeopathic Medical College, third year student. So I used to continue my study from one of my relatives' house, my auntie in nearby Hedwa, Goa Bagan. And I used to know that they had only one granddaughter who is suffering from infertility for uterine tumor to the extent completely packed up fibroids. His uncle, that means my auntie's granddaughter's uncle, was a very famous general physician of Central Calcutta near Girispal. And incidentally, Dr. C.S. Dhar, famous gynecologist, who have many books you might have read, he was his classmate. So when I used to go there, when I had the case has been seen by the C.S. Dhar, and he has said there is no chance of pregnancy because uterus is packed up with tumor. He should be complete uterus should be taken out because he is early aged. So let it be continued, let it stay there fibroids, packed up fibroid uterus because of hormonal problems. Otherwise, the conjugal life may be disturbed to some extent. But if bleeding starts, menorrhagia starts, we have to take the uterus out. So in that situation, she was maintaining for 17 years. I had one habit of reading from here, there, casual study. So incidentally, when I was casually studying Ellen's Mathematica, at that time, Dr. Dubey was such a very strict person. If we do not carry Ellen's Mathematica book within the college campus, he used to ask us anything, and even he will kill you by slaps and other things. And he used to tell that I do not want to see a single student in Calcutta Homeopathic College without book of Ellen in hands. So by that habit, casual time, when I turn the pages, I finish the last pages, Ellen's Mathematica, there is an epihistidinum drug. I will tell you the page number. The book is with me at this present. You can see it, page number 452 in mid area. Epihistidinum, it is clearly mentioned the medicine is made from the fibroid of uterus. So I was stunned. Such a medicine had not been used in general Mathematica. It has given in the rare pages. So I just learned it and keep it in mind that if I get any chance, if they ask me to help, I will try with this epihistidinum. After long 1.5 years, one day suddenly that fibroid mother, he was my close relative, then he was crying. Before me, I was studying at night. Then, why are you crying? Now, my life is going to be spoiled. It is of no use to live. Because by this time, he has been separated from her husband because she had no child. Then it stuck to my mind. Then she's telling, can you help me by homeopathy? Whole family was completely allopathic minded. Their relatives are big allopathic doctors, and other friends are, as I told you, C.S. Dhar, etc. Subroto Banerjee, great surgeon of Calcutta, Central Calcutta. Anyway, so then I took the chance. Then I told, okay, I can try but I don't know what will happen. But whatever, my life is going to be lost. If anything happens by your trial, please talk to your teachers and give something. I didn't talk to any of my teachers because by this time I studied fibroid and I found that there is no cure except operation. I purchased the medicine from Hahnemann Publishing Company and started giving 30 potency daily. She continued. Then after 3 months, they asked him to have one ultrasonography. Ultrasonography report came, multiple fibroids. Previously, it was packed up with fibroid. Now report came multiple fibroid and such a little gap is being found within the uterus. I was highly encouraged. Then I asked the mother, you go to, by manipulating, go to your husband's house and avail the 14th day. His menstruation was almost regular, though there was little bit menorrhagia. You might be knowing the fertilization date, 14 plus minus 1. I asked the mother to use it, and through common sense, I used that you should not be very hasty. First, improve your libido, then have foreplay. Then after the act, don't get up immediately because system is weak, uterus is sick. So your sperm may not reach to the fallopian tube or nearer to ovaries because of multiple reasons. So I asked her to lie by keeping a little pillow below his waist, by putting the hip little bit above the bed for more than 10-15 minutes. And I asked her to continue this mechanism. If there is a little, if a little reduction is there, so there is chance of reduction or management when the uterus will start increasing its size due to pregnancy. And you'll be surprised to know, after 6 months, one day he came back with pregnancy positive. What happens? Immediately they took to CSDA. Immediately. Dr. Das said until, this is a blunder you have done. Now you have to lost either the baby or the uterus or both of them. Decide and tell me. Party came back, discussed with his uncle who is famous general doctor. He told, once we have found that pregnancy is positive after so many years, 17 years, and uterus is having some cavity, can continue homeopathic medicines. And he'll be very happy to know that one of his son, he has made one of his son, all other sons and daughters are doctors. He has made one son homeopathy doctor. Anyway, he asked to continue. Pregnancy was continued. CSDA told, I won't see the case because I don't want to earn defaming. Around 2.5 months, suddenly patient started bleeding. Those who are from Calcutta Homeopathic Medical College, today's CME, they might be knowing Dr. K.K. Roy. Immediately I went to Dr. K.K. Roy, my teacher. He has started taking classes in 3rd year gynaecology. That this is the situation. I gave a medicine. The mother is pregnant. Now started bleeding. Then he told, gone. No chance. There's no use of going there and treating the patient. By my earnest request, it went to the patient, saw her, and asked him to lie by keeping the legs much higher up and head below, complete bed rest, urine stool on bed, and wait for minimum 3 days. If there is change, then it will be continued. If there is no change, pregnancy immediately should be terminated for the safety of mother. Incidentally, once I heard that there is chance, I gave few doses of CME by thinking that 2.5 and 3 months. By his medicine, he gave some medicines. By Dr. K.K. Roy's medicine or by CME, bleeding stopped. Pregnancy continued under rest. And ultimately, in Arjigor Medical College, CSDA, by instruction of Dr. CSDA, that was operated by 3 gynecologists to save the mother and to see what has happened. Baby became normal. There are fibroids during pregnancy, but they are very thin, very little, and very, very tiny fibroids are found during cesarean section. With the baby, mother came back. After 6 months, ultrasonography, uterus normal. So this was my first history of infertility. Since then, I had a separate confidence that homeopathy can do miracles, many things. By these long years of experience, I have observed, that is for your convenience, you can try by this medicine. What I have understood, that is infertility to mothers, if husband is not normal, mother don't have any organic defect or chromosomal defect, but infertility, definitely there are some hormonal problems. If there are some hormonal problems, definitely some psychosomatic problems may be before they are in family circumstances, family turmoil. And usually what happens, as Madam Ompriya told, that once a married wife do not get pregnancy within 1 and 2 years, especially in villages, the lady become victim. Everybody blames her. You are to be blamed because you don't have any child. Now that is psychological traits which instigate thyroid and allied hormones to become sensitized. If not, liberation of thyroid hormone become ups and downs, but receptor cells by T3, T4, TSHs may be sensitive, leading to infertility type of complex mechanism. So that's why what I have seen, these patients without any structural problem, sperm analysis normal, not getting normal pregnancy, and undue flux on the body, T3, T4H is normal, flushings of heat, easily get tempted, very good or normal appetite with reduction of strength, physically becoming weak, eating normal. And if you get hot skin, and incidentally, if you get desire for sweet, I have tested thyroidinum in higher potencies in multiple cases with nice success, beautiful success. And one more thing, usually homeopath patients comes after multiple trials. So for nosers also, from coming from multiple trials of modern medicine, homeopathy doctors, if you get those type of cases with those type of symptoms, one thing for thyroidinum. So anyway, definitely constitutional drugs, the and the solution. It can cure many incurable cases, so-called incurable cases. As Dr. Madam told us, bicornuate uterus, it is beyond imagination that mother can get pregnancy. As I told you, pact of uterine fibroid, it is beyond imagination. But homeopathy, miracles are for homeopathy, I can tell you, in the therapeutic world. So friends, be encouraged, because we are more getting modernized, more purchasing diseases by expending huge funds, more purchasing diseases, more infertility, more there are iatrogenic causes of infertility, more the need of homeopathic help is gradually increasing in the society. So please be encouraged. Especially I am telling Dr. Sarkar to come forward. Okay. Many thanks to all of you. And please inform us, good speakers with documentations and their experiences by which all of us will be encouraged. Thank you all. Many thanks, especially to Bidyut and his son.
Thank you so much,
Thank
sir.
you, sir.
Thank you,
Thank you
sir.
so much, sir. And this was a wonderful uh, speech by Dr. Kalyani, sir. His addition into the subject went wonderful today. And what I believe is that Dr. Mukherjee is uh, traveling somewhere. He is busy with that. So I will request all of our honorable guests out here in this platform today to stay back for some time after we end this webinar today. Before we end, uh, we have an announcement as a regular announcement what we do in this platform, that Alumni Association not only hosts a seminar, a webinar in this platform, but it has extent of work in terms of generating a benevolent fund, and this fund is being spent in the distress of our alumnus. When we lose, we lost someone our near and dear, and when someone is sick and needs support from our alumni association, we do that. And for that reason, we are generating a fund, and the fund is quite good in amount right now. Still, for a preparedness, we are requesting all the alumnus to be in this platform and to contribute a small amount of contribution for the benevolent fund. And as you all know, we are right now uh, around 22,600 number of alumnus in this platform. We have our ex-DPNI students, we have BHMS students, and we have the MD students of our institution. All are alumnus, and we are working together, and we are hosting this continued medical education. And the next time we will be hosting the 50th CME program in this platform. I believe it is a huge success. And this webinar remains in the YouTube, and the viewer are quite satisfactory in number. And this YouTube channel is very informative in terms of when alumnus cannot see this webinar at right this time. will be viewing this in near future. And this is a good effort made by the alumni association. And this whole alumni association and the CME, the contribution of Dr. Mukherjee and his son Orko is uncomparable. And we all, the alumnus, are thankful to Dr. Mukherjee as well as to his son for this continuation of the CME program in this platform. So once again, I would like to thank all the viewers right here today. And I'd like to thank Dr. Subhamoy Sarkar, Dr. Ompriya Mishra, Dr. Kalyani sir, Dr. Bidyut Mukherjee sir, and of course, all the viewer, to all the alumnus, those who have joined this webinar today, and those who will be viewing this webinar platform in near future. Thank you so much. With these few words, Dr. Kalyani sir, with your permission, let us end. Let us declare
Sure.
this webinar is closed today. Thank you so much.
Sure. Thank you all.
And
Many,
please
many
stay back.
thanks. Please come again.
Thank you.
Thank you.
And please stay
Thank
back.
you.
And
Yeah.
please stay back.
Good night.
Good night.
Thank
Good
you.
night.
Good night.
Thank you. Probably there is some network issue.
Sir, can you call Orko, sir? Because my
Just
phone
call
is
also
engaged.
probably some network issue, I think.
Orko is there in this platform right now.
Now,
He's
Bidyut
trying
is
to.
writing that there is net issue.
Okay.
Yeah, Bidyut has joined.
Bidyut is also there.
Bidyut has come back.
I am
Bidyut, everything is over.
discuss the entire process that Orkut has been trying to go with the process from a separate table. I will thanks to all the speakers for July, Ompriya and Subhamoy. With this, I will be trying to return back to backstage every time lost the permission of Kalyani sir. So can we close now?
Sure. Close it.
Yes. Please
Thank
close.
you so much. We are ending this program and next 12th of June we'll be back with our 50th state online with a panel discussion with some very motivating and time-bound topics. Homoeopathic in 2030 with its speech of four-way approach. The link and the promo will be published soon. Good night, everybody, and with this we are returning and ending the broadcast. Bye.